Good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. First, the highlights. The federal government launches toll-free mental helplines for people infected and affected by COVID-19. And the majority of intending pilgrims in Plateau State receive first AstraZeneca jab ahead of journey at the end of the month. And an independent review panel set up by the World Health Organization says the WHO and global governments should have declared a global emergency earlier, calling their combined response a toxic cocktail. Well, today saw the dispensing of a bitter pill for governments around the world, and surprisingly, the World Health Organization to swallow. But we'll get to that soon enough. Meanwhile, in a few hours from now, Muslims across the country will be celebrating Eid al-Fitr, which marks the end of the holy month of Ramadan. But no thanks to COVID-19, this year's celebration will be quite different, especially in light of Monday's announcement of Phase 4 restrictions by the Presidential Steering Committee on COVID-19. So here's what you need to know about Phase 4 as it concerns religious gatherings. So one, all gatherings linked to religious events would be limited to less than 50% capacity to ensure physical distancing, and of course, face masks are mandatory. Also, gatherings of more than 50 persons must be held outdoors only, and all those attending must observe all mandatory non-pharmaceutical interventions. So there you have it. These are some of the major points to note ahead of the celebrations tomorrow. And
in line with the recent review by the Presidential Steering Committee on Nigeria's COVID-19 response, the Nigeria Center for Disease Control is asking Nigerians to adhere to health measures and the restrictions in place to reduce the risk of spread of the disease in the country. The latest figures coming from the NCDC are 47 new infections reported from 6 states and the FCT. 19 new infections were recorded in Adamawa. Lagos had 16 cases, while Enugu and Kaduna recorded 3 cases each. 2 new infections were also recorded in Akwa Ibom, Delta and the FCT. Nigeria now has a total of 165,515 confirmed cases. The agency says 40 persons have been discharged after recovering from the virus in the last 24 hours, increasing the number of recoveries to 156,358. According to the NCDC, Rivers, Taraba, Niger, Sokoto, Cross River, and Kogi states currently do not have any cases on admission, while Nasarawa, Ondo, and Lagos states account for states with the highest number of cases still on admission. No deaths were recorded in the last 24 hours, leaving the total fatality toll at 2,065. In the latest update by the National Primary Healthcare Development Agency, over 1.7 million people have now received the first dose of the Oxford AstraZeneca COVID-19 vaccine, representing 85.2% of eligible persons targeted. The country is also making plans to commence the administration of the second dose on eligible persons who have received their first shot across all states. As the vaccination campaign in the EU is gaining speed with 200 million jabs delivered and COVID-19 infection rates falling, the European Commission says it plans to introduce the COVID-19 certificate this summer to allow citizens from the 27-nation bloc who have been vaccinated, recovered from the virus, or tested negative travel without restriction. Over 159 million confirmed cases and more than 3.3 million deaths have been reported across the world.
The federal government has launched the 112 mental helpline to provide nationwide free telecounseling services for those adversely affected by the psychological effects of a COVID-19 pandemic. Speaking at the launch in Abuja, the Minister of Special Duties and Intergovernmental Affairs, Senator George Akume, explains that it's a collaborative effort with the Ministry of Communication and Digital Economy to tackle the increase in mental health challenges of Nigerians. Senator Akume adds that the World Health Organization is supporting the initiative, which he hopes will have a meaningful and sustainable impact on vulnerable Nigerian communities during and after the COVID-19 era.
The strategic preparedness and response plan outlines the public health measures that the Mindway project intends to implement, especially as it relates to mental health. The Mindway project is out to support the populace with free telecounseling services during this COVID-19 pandemic. The counseling will take into consideration what Nigerians and other members of the public have gone through during the period of the lockdown and other appropriate counseling services that could enhance mental well-being and foster community resilience. It is supposed to state that the World Health Organization has also welcomed this initiative and is ready to support the objectives of the Mindway project in providing free telecounseling services to Nigerians infected and affected by the COVID-19. In addition, the Ministry of Communication and Digital Economy has graciously provided toll-free lines for the services.
Well, the Lagos State government is confident of its readiness to manage the third wave of the COVID-19 pandemic. Well, the State Commissioner for Health, Professor Akinbayomi, says a 5-pillar strategy has been put in place to mitigate the third wave of the pandemic. Passengers coming from high-risk countries like India, Brazil, and Turkey will be isolated for 7 days in any of the state isolation facility. And the state government is asking residents not to panic, but obey all the COVID-19 guidelines to win the battle against the virus.
In terms of being able to curb or to prevent the third wave, we are carrying out this strategy alongst 5 pillars. The first pillar is to make sure that we keep our testing high so that we can pick up early any evidence of a third wave emerging in the community. In addition to that, if we find positive cases, and that's in the first pillar there, if you are positive, we're going to repeat your test, this time with another type of PCR that can detect the possibility of mutations. So we are equipping the Lagos State Biobank with the capacity to do 2 types of PCR tests. The first type is just to pick up a positivity, and the second type is to try and help us characterize that virus and put it into either one of the strains that we know are circulating around the world, from South Africa to Brazil to Europe and to India. In addition, we're using eco-telemedicine and what we call the eco-telemed platform to manage people at home. But more importantly, as people are arriving from abroad, which is the most likely reason why we might get a third wave, which is because passengers are coming in from exotic countries and they may be bringing along with themselves the mutations and the strains of the new viruses. Of course, the third pillar there is the standard hygiene principles and social distancing that we are all familiar with. We are imploring all Lagosians to stick to the non-pharmaceutical interventions of social distancing, personal hygiene, respiratory hygiene, and avoiding large gatherings which may turn out to be super spreader events. We are ensuring that we have the capacity to make more and more oxygen in Lagos State. We have just installed 2 oxygen plants, and we're looking at a 3rd and a 4th, just to make sure that should we go into a third wave, we will not be experiencing the scenes that we see on television in India, Brazil, and other countries.
And out to Plateau State, where intending Christian pilgrims have received the first jab of the AstraZeneca vaccine as part of requirements for their journey to Israel, which is commenced by the end of the month. In all, 44,000 residents have received the first dose during the first phase of inoculation, which ended on May the 8th.
Among Christians, the idea of pilgrimage to Jerusalem follows the visit of Jesus Christ to the city where he spent the week leading up to his death.
Allahu Akbar.
For Muslims, Hajj is an annual pilgrimage made by the Muslims to the holy city, Mecca, in Saudi Arabia, according to the injunction of Prophet Muhammad. And it's in preparation to the visit to Jerusalem and Mecca by Christians and Muslims that intending pilgrims in Plateau State are being asked to fulfill the mandatory requirement of vaccination before embarking on the pilgrimage. Already, Christian pilgrims to Jerusalem are being administered with the AstraZeneca vaccine. The holy pilgrimage is expected to commence by the end of this month.
First of all, we have encouraged all our intending pilgrims to go for their first shot to get themselves vaccinated. And a good number of them have been vaccinated. We're encouraging them wherever they are, they should do the same. We hope that by June, those who got the first round will get the second round.
Majority of the 600 intending pilgrims from Plateau State go through certain medical processes to ascertain their health conditions. And this is in addition to taking the vaccine.
What is coming up now is for every intending pilgrim to have himself tested. So it is not the issue of vaccination. Everybody must be tested. Your result must be out like 1.5 days before boarding. So samples of our intending pilgrims will be taken, and we will ensure that they are all tested, and they will have their certificates before we embark on this journey this year.
One of the pilgrims who spoke to Channels Television expressed satisfaction regarding the process.
I've taken the vaccine already. I have filled the form, so I've done the screening. I'm waiting for the orientation, time so that I'll participate.
44,000 residents of Plateau State have received the vaccine in the first phase of the exercise. According to the Plateau State Primary Healthcare Board Secretary, the administration of the first dose of vaccine ended on May the 8th, while the second phase will start next July.
So for more on the situation in Plateau State, we're joined by the Executive Secretary of the Primary Healthcare Development Agency, Dr. Livinus Miakwak. He joins us virtually. It's great to have you on the program, Doctor. Now, while the debate about whether or not pilgrimages are essential travels continue, let's talk about the vaccination drive in your state, particularly, seeing that Plateau State has so far recorded the 4th highest COVID-19 cases in the country. First, what is your biggest challenge, really?
Yeah, actually, the main problem we've always had initially when we started these programs was the issue of people accepting the vaccine in the first place. And because there were a lot of myths and misconceptions. But immediately after we flagged up the vaccination on the 16th of March, which was done by the executive governor, a lot of people came out. Because if you can recall very well, Plateau was among the first 5 states in the country that were doing a lot of testing, and there were a lot of positivity among those tested. So we had to really go on serious, massive drive. And immediately after the first dose, people started coming out to accept it.
Now, having received over 105,000 doses of the vaccines, I mean, you vaccinated 44,000 during the first phase, which has ended already. Clearly, you will be vaccinated 44,000 during the second phase as well. So the question is, what happens to the outstanding, I think, 17,000 at least doses? Will they be destroyed, or will they be used for another phase of forced dose administration?
Yes, actually, from the data available, the 44,000 is the one that have been uploaded to the server. But there are a lot of backlogs, but we are hoping that we'll be able to meet up with the 52,000 that we're supposed to vaccinate. Because, initially when the vaccines came, the whole idea was to exhaust all the doses during the first dose of the vaccine. But from the information coming from the national, that due to 1 or 2 logistic reasons, we may not get the second dose of the vaccine before that time. So we're advised to give half of it so that those that have refused the first dose will receive the second dose of the vaccine. So for now, by the time we finish uploading the backlog of what has been done to the server, I'm sure we'll be able to meet up with the 50%.
Well, Dr. Livinus, it's been a pleasure speaking with you, and wish you the very best in the vaccination drive. We'll go on a break now. And when we return, we'll be speaking with a journalist in India to get updates on the recent developments regarding the fight against COVID-19 and what's happening in neighboring Nepal. To join us again. You're welcome back. The Taraba state government is asking residents to get vaccinated and avoid skeptics who may try to disabuse their minds against taking the COVID-19 vaccine. The Commissioner for Health in the state, Innocent Vakai, during the handing over of projects donated by the Victim Support Fund in 3 secondary schools of the state, believes that the turnout can be better. Just over 23,000 residents have received the jabs, while 90% of health workers have been inoculated.
So far, so good. People are responding. We have some few skeptics that are disabusing the mind of people that they should not take it. But most people are taking it. I want to assure people that the vaccines, the AstraZeneca one we are using in Nigeria is safe, very good efficacy. You could have watched on tele, the governor himself have taken the vaccine. I have taken the vaccine. The SSG, the speaker, on the day of the launch, we all took the vaccine. So we encourage people to go ahead and take the vaccine.
And outside Nigeria, India's COVID-19 battle is still very much of a concern to the world at large. The WHO recently designated the B1617 Indian variant a global variant of concern, as it has now spread to over 17 countries, including Nigeria. And just when there seemed to be some reprieve with daily cases dropping below 400,000, the world was shocked to see dozens of bodies floating on River Ganges. Well, Nabila Jamal is a journalist in India, and she joins us live from Delhi to give us some more updates on the situation there. Nabila, great to have you on the program again. I mean, it was a deeply disturbing sight, I must say, seeing those bodies wash up on the Ganges River. What more can you tell us about the investigations and the general mood there?
Well, what I can say is that families are devastated. Many of them not finding a space at crematoriums. And that's why we see crematoriums running full. It seems like people there along the Ganges looked like they had no choice, thought that the water was holy and that was the only send-off or dignified send-off that they could give to their loved ones. And what we should be looking at here is the fact that crematoriums are running full. In fact, respective state governments, districts are finding new spots to come up with new burial grounds, new crematoriums to accommodate the onslaught of bodies that are coming in of those who lost their lives to this COVID pandemic. It is unfortunate. We're looking at daily case count today at about 3.5 million, with 4,205 deaths that's been reported in the last 24 hours. Even though we are seeing a case, the daily cases have dipped a slight bit because of several states that have gone into a complete lockdown, but still it doesn't seem like the worst is over. We have a long way to go because we've barely got about 10% of the population got one dose of the vaccine. Only 2% of the population has got 3 years, before which our entire population of 1.4 billion people will be vaccinated. And that's what's the worry here, because the more we delay the vaccination, the more we are noticing that the coronavirus strain is mutating. There are that many mutant strains that have been found in India, and it seems like that's what's risky now. Will these mutants, or will this vaccine beat the mutants that we see day after day that's cropping up?
And I think to boost that whole vaccine conversation and production generally, India has also thrown its weight behind, waiving of a vaccine patent and the rest. Just how far has that gone, especially seeing that India has a huge capacity to actually produce vaccines compared to other countries?
Well, our Prime Minister Modi is considering that. In fact, a lot of the opposition parties have been criticizing the government for not opening up or not flexing the manufacturing units or share the patents with other manufacturing companies. It could have been done by now. It seems like the pace is slow. we have learned from our lessons, but well, not in time, it appears, before we've lost so many lives. But now there is consideration for flexing the patents that are already existing in India so that more production companies now come forward to manufacture the COVID-19 vaccines. In fact, India has also requested the United States to share its patent. The United States is still mulling over it. But nonetheless, we are getting vaccines from Russia. The first consignment has already come in of Sputnik V. In fact, India is also in the government itself. The government of India has incentivized the COVID vaccine manufacturing companies with thousands of crores of funds so that they can maximize their production. So we are looking at this happening, but understandably at a slow pace, considering that the entire country is a lockdown, the government is in shock, people are in shock, so they're trying to pace it up. It doesn't seem like it's working in time, though.
Well, Nabila, another concerning development is seeing people use cow dung as some perceived cure for COVID-19. Now, I know there have been very unusual methods employed to cure this virus, but where did this come from?
Well, this is definitely not certified or stated by any medical expert or professional in India. This is, of course, on the sidelines in rural areas. People are trying to use all sorts of cures to fight COVID. It's the scare and the panic that's resulted in this kind of fallout where people are reacting in different ways. They're trying different measures, trying different methods to kill the virus. Unfortunately, that, like I mentioned again, we're a population possibly where it's very difficult for people to reach out far and wide, villages and rural areas, to try and make people understand that this virus is real and it's not a curse. Many of them still believe that this is just, it's just a propaganda. It's a Chinese propaganda. It's just a story which will, fade away. And it's a curse. Many of them believe it's a curse. And that's unfortunate because we're looking at India having about 40% of the urban population, which are more educated and more enlightened, versus close to 60% of the rural population who lack the knowledge that COVID-19 virus is something that is serious and it can't be cured with ingredients like you mentioned. So this is a knowledge that is slowly and steadily being dispatched, but we're getting there.
I know with over 1 billion population, it must be a huge challenge on the hands of the government. But I'd like to thank you so much, Nabila Jamal, for always sharing your thoughts on the program with us. It's been a pleasure.
Thank you very much, Coyote.
A toxic cocktail. Well, that's how an independent review panel set up by the World Health Organization described the combined response of the WHO and global government to the COVID-19 pandemic. Well, it said the Global Healthcare Agency should have declared a global emergency much earlier than it did, and that without urgent change, the world remains vulnerable to another major disease outbreak. Well, here's more on the Global Update.
The review panel set up by the WHO has called for bold reforms and revitalizing national preparedness plans to prevent what it calls another toxic cocktail.
The world was not prepared for this one. It must be prepared and ready for the next. Pandemics are an essential threat to humanity. Yet outside of a crisis, preparedness is all too often relegated to the ministries of health.
In other parts of the world, such as South Africa, the infection rate is steadily picking up as concerns have grown over 2 new variants of the coronavirus. The dominant B.1.1.7 variant first detected in the UK and the B.1.5.1.7, which sent India's infection rate skyrocketing, have been detected in the country. And in India, the COVID-19 death toll crossed the 250,000 mark, bringing its total tally to 254,197, so says the Health Ministry. As many as 4,205 deaths, the highest so far, were registered during the past 24 hours, marking the country's 21st consecutive day, reporting over 300,000 new cases a day. The total number of confirmed cases reached 23,340,938, after 348,421 new infection cases were reported over the past 24 hours.
Well, you might be on a holiday, but the virus isn't. So don't forget to protect yourself and continue to take responsibility. Also visit our website, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories from business to politics, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I am Kayode Okikilu. Happy holidays.